New South Wales now has a firm target and a plan for emerging from lockdown, but plenty of questions remain this morning about just how proof of vaccination will be policed and how the state and the rest of the country will manage as case numbers increase. Premier Gladys Berejiklian yesterday confirmed hospitality, gyms and retail will reopen when the state hits 70% of adults fully vaccinated, a milestone expected to happen in mid-October. But those freedoms will only be available to those who've had 2 jabs.
Business leaders are optimistic, but some are worried about refusing service to unvaccinated people. And the AMA is concerned the plan risks overburdening the New South Wales health system. Meantime, large parts of regional New South Wales are set to emerge from lockdown tomorrow, while regional Victoria eased restrictions overnight. We'll be in Ballarat very shortly, but first let's bring in the New South Wales Deputy Premier John Barilaro in Sydney. Mr Barilaro, good morning. As regional New South Wales, or large swathes of regional New South Wales, come out of lockdown from midnight tonight, what's your key message to the residents there?
Yeah, good morning, Michael. Look, the message is that we still have to be vigilant. We still have to follow the rules. We are opening up large parts of regional and rural New South Wales, but in a very restricted environment. A lot of conditions on pubs, clubs, restaurants, cafes, movement, activity, certain sectors, and we just need people to abide by it, because the reality is that we do have cases in the regions. We have our sewage surveillance, our contact tracers that, of course, are always alerted to what's occurring on the ground, and I really don't want to have to lock down regions again, but we have said if there are cases that pop up in any local government area, I will be shutting down those local government areas for a 14-day period.
In fact, all you need is a single case, right, before you go into a 14-day lockdown?
Yeah, absolutely. You know, we know with Delta, it's so transmissible and contagious that we have no other choice but to shut down. And we've done that previously before the broader shutdown in the regions. We had a situation in Armidale and in Orange. We shut down for a week or 2. We got on top of it and then we reopened. So same approach continues.
Well, lots of business owners in country New South Wales are obviously happy about this. A lot, especially in the hospitality sector, are pretty concerned about how they go about policing who's vaccinated and who isn't. What advice, what guidance is the government offering them?
Okay, so for the first thing, for the opening of the regions this weekend, it's for everybody. We're not opening just for the vaccinated. Yesterday we made 2 announcements. One is opening regional rural New South Wales under a new restricted environment, and that is for everybody as we come out of this particular lockdown. But as we get to the 70% the 70% roadmap that we launched yesterday as well, which will be a statewide roadmap. At that point, we are then only opening up for vaccinated people. And the answer to your question is we'll be working with businesses over the next few weeks through Service New South Wales. Minister Dominello is preparing the Service New South Wales app, the QR sign-in, where it'll also have on it your vaccination status, and that'll make it easier for customers, for businesses to police by a simple app.
OK, so as things stand at the moment, New South Wales will reach that 70% double vax target roughly by the middle of October. Yesterday, the state recorded 1,400 new cases. The Premier says the cases won't peak until another week, possibly a fortnight. So we're still talking about hundreds of cases by the time 70% is reached. Are you completely comfortable in reopening the economy at that point with so many cases still out there?
Yeah, look, we've applied the Doherty Institute work. We've looked at the national plan. We've gone much more conservative. We've taken into account our hospital capacity, our surge capacity in ICU, our workforce. That we released that last week. We believe by the time we get to the middle of October, with the vaccination rates the way they're going, by Monday we should probably most likely be 80% first dose right across New South Wales, which is a fantastic achievement. And so we believe that next week we will peak. That's what the modelling's always said. And then we'll start seeing the R effective drop. We'll get under 1. We'll see case numbers come down well before we open. But there will still be case numbers, and we've left in the roadmap the opportunity for health, if we believe there are areas that are of concern, that we will still possibly put in place some suppression measures.
Not everybody's happy. There are numerous reports, as you know, that the Chief Health Officer, Kerry Chant, was pushing for an 85% threshold before you're doing what you're about to do at 70%. Did she offer that advice initially to the New South Wales government?
Well, Michael, I'm the architect of the roadmap. I took the roadmap to Crisis Committee, and before I did that, I actually had Health's endorsement. Otherwise, it would not have got through Crisis Committee. Of course, Health, if they have different KPIs to the government. If you wanted to be certain, you put in place a lockdown that takes you to 85%. Their KPI is no hospitalisations, no deaths, no infection.
But the government also follows health advice. That's what we've been hearing all the way through. You follow health advice.
But Michael, we have. The 70% roadmap is endorsed and supported by Health, Dr. Kerry Chan and her team.
Right, OK, she just seemed a bit uncomfortable at the media conference yesterday, not exactly a full-throated endorsement of that 70% target.
Well, I sit in Crisis Committee. I prepared the document. I had agreement before going into Crisis Committee. We then discussed the document, made a number of changes through that meeting, and again continued to have the support of Health and Dr. Kerry Chan. At the end of the day, I can put hand on heart that we've got Health support. There's always going to be speculation about what Health would like, what others would like, but I have a roadmap on the table that is supported by Health. OK, we'll see how it goes. Hey, before you go, now the New South Wales government has been critical over the past few months about a lack of vaccine supply, particularly Pfizer. We've heard this from the Premier, the Health Minister, Brad Hazzard, and others. What do you make now of those Pfizer emails that show the federal government not acting as quickly as it could have to sign a deal with Pfizer in the middle of last year? Well, again, you go back to the middle of last year. It was uncharted waters. No one knew what was happening. I'm sure the federal government was being lobbied by many pharmaceutical companies about a possible vaccine, and at the time it wasn't a vaccine that was already approved. It was a vaccine in conception and production or idea, and the reality is they managed it the way they did. And look, we're always lobbied as ministers in our sectors by businesses about ideas and products, and my view would be it was done appropriately. Yes, we would love to have seen more Pfizer now, but we haven't. We know there's more coming. By October, it will have surplus supply. So, look, no point looking backwards. I'm looking forwards, and I'm looking to opening up the state attached to our roadmap.
John Barilaro, thanks for joining us this morning.
My pleasure. Thank you.